Today, we're going to talk about a really important topic for your fertility, and it's your cervical mucus and monitoring it to know exactly when you're fertile. If you are not using this, you are doing yourself a great disservice. A lot of women will use LH predictor kits and other things, but if you don't rely on your body, then you're missing out. You just really are. Let's talk about it. The cervical mucus obviously is produced by the cervix. It reflects hormonal shifts during your cycle. It is a guide for your sperm through the reproductive tract, and it's essential for understanding your fertility, and it indicates the most fertile days for you. It will indicate hormonal changes, and it greatly helps you track ovulation timing for conception. You are fertile 5 days before ovulation, the day of ovulation, and the day after ovulation. So if you are just using LH prediction kits, those are just going to tell you when ovulation is going to happen 24 to 48 hours after that. But if you think about it, you're missing key days before that if you're not paying attention to your body, and your body will always tell you. Let's talk about the types of mucus. Cervical mucus, which is dry or sticky, indicates you're not fertile right then, often occurring post cycle. During this time, your body is not primed for conception and your hormone levels are all low. So, sticky is also the same thing. But when it starts going from dry to sticky, you're starting to shift more into your fertile phase. So paying attention to that can be very helpful for you. A lot of women think that they ovulate at day 14 with absolutely no evidence to this. And I'm going to tell you right now, a lot of women don't ovulate exactly at day 14. So paying attention to your body signs and signals will give you a lot of great information. The types of mucus. So this is a diagram from the Cleveland Clinic, which is very well respected. Days essentially 1 to 6 are dry and sticky. That is not fertile. Days 7 to 9, you're coming into a more fertile phase and it's creamy. Days 11 and 12, it's wet and clear. Days 11 and 12, it's wet and clear. And these are fertile days. And then egg white consistency where you can stretch it between your fingertips, that is extra fertile. These days are a guideline. Women don't necessarily adhere to these days, which is why I'm trying to tell you that you need to pay attention to your body. The days can last a little longer, be a little shorter. It all depends on your hormones and their fluctuations during the cycle, in addition to when you're ovulating. The dry and sticky is minimal cervical mucus production. Your hormone levels are low, and awareness of all of this shifting is really, really beneficial because when you become more sticky, you're heading into your more fertile phase. As you get closer and closer to ovulation, your cervical mucus shifts and it becomes a little bit more creamy. This signals that your body is starting to prepare for fertility and your estrogen has started to rise. Once you get to the wet and clear phase, you are fertile, and it will indicate that ovulation is coming, and the wet and the clear can definitely indicate key fertile days for you. When it's egg white, clear and stretchy, slippery, that is your height of your fertile days because that is when you're ovulating. Okay. So paying attention to these phases will give you great information about your body and when you are ovulating. You can use the LH predictor kits, but I would count more on this than I would on LH predictor kits because ovulation can also change every month. It can change based on illnesses, stress, a whole host of reasons. So don't get into that trap of thinking, oh, well, I'm just going to start 5 days before day 14, do it on day 14 and the day after. No, even every other day. No, because you might be missing really key fertile days. And some people even miss their fertile window altogether doing it that way. Let's review. Types of mucus: dry and sticky, days essentially 1 to 6, creamy, days 7 to 9, wet and clear, days 10 to 12, egg white, days 13 and 14. The advice is to have intercourse every other day, starting when it starts to get creamy. If you know that your partner's sperm count is good, then you can have intercourse every single day. If you're not sure about that, then just go every other day. As I said, fertile days are 5 days before your ovulation, the day of ovulation, and the day after ovulation, because the egg is viable through the day after ovulation. Let's talk about tracking it. How do we track it? How do we look at this? You can do a few things. You can do a wipe test with TP when you go to the bathroom. So before you go to the bathroom, obviously, you gently wipe your vaginal area with that clean tissue to see what the consistency is that comes out on the tissue. You can use your finger. Obviously, you want to wash your hands before you do this, but you insert your finger into your vagina and then you can observe the mucus. Or you can observe discharge in your underwear. Healthy mucus is clear, stretchy, mild odor. Stretchy when it becomes most fertile. Unhealthy mucus can become discolored, like it's yellow or it's green. It has a strong odor typically, and you can have some irritation down there, like itching. If you have any of those things happening, it is a best idea to go see your local OBGYN to figure out what's going on. But understanding the differences is crucial for looking at your body's overall health and the overall health of your vaginal area. How do we improve cervical mucus? Well, let's focus on staying hydrated. You need to drink lots and lots of water. Diet Coke is not hydration. Nothing with caffeine is counted as hydration. And don't drink more than 200 milligrams of caffeine a day when you want to get pregnant. Incorporate healthy fats like avocado oil, olive oil, avocados. Some nuts and seeds are a good idea. Add vitamin E into your supplement mix. Probiotics can be a great idea. You also need to minimize fear, worry, and stress, and stabilize your blood sugar levels. Abiding by the cervical mucus checking is going to help you so much to know what's going on with your body. And when ovulation shifts, it's not every month, but it does happen. You will be on top of it because you will be listening to your body. And you will know that when your cervical mucus becomes wet, that is when you're coming most into your fertile time. So pay attention to your cervical mucus because your body is going to tell you better than any app, better than any LH strip, better than anything else. You can use those things, but I highly, highly recommend to use the cervical mucus in conjunction with anything you're doing to predict your ovulation. If you've been having a hard time getting pregnant, you do want to check out my free masterclass. It reveals hidden blocks to pregnancy, and you will finally find the answers you deserve. And check back here for great tips and tricks. Bye.